Death toll from the Congo volcano eruption has risen to at least 20 now. 5 people were found choked to death on toxic fumes on Monday. Mount Nyiragongo erupted on Saturday, causing hundreds of thousands to flee to their homes in Goma. The 5.1 magnitude earthquake was felt in neighbouring Rwanda. A stream of lava flowed to the outskirts of Goma, cutting the city's electricity supply. Yesterday, the area was rocked by several tremors, with the residents concerned it might trigger another eruption. The volcano's previous eruption back in 2002 killed hundreds of people. Well, for more on the situation in Goma now, let's chat to the DRC's ambassador to South Africa, Bene Mpoko. Ambassador, a very good morning. Thanks so much for your time. What is the latest information you have on the death toll? Let's start there, because we're seeing various numbers on various media platforms. What are you hearing from your side?
Different teams are making the assessment, so they're trying to coordinate the numbers. But as of last night, we were at 35. This morning, I have not talked to Goma yet, so I don't have the most current one.
All right, so that's at least 35 is what you're hearing from your side. What can you tell us in terms of the movement of people who have been affected, in terms of families and missing children as well, we see is a very big concern at the moment?
It's a major disaster because the people are moving to the neighboring Rwanda. People are running all over the place where they can find, where they're just running away because they know from the experience of 2002 that this thing, when it starts, you don't know where it's going to stop. And therefore, they're running, they're in the bush, they're in the mountains, they're all over the place. And the Goma gets very cold. So the situation of the children it's a major concern. Some schools have been destroyed. Some clinics have been destroyed by the lava, and especially the farming community has suffered major losses because the animals are running, they are burning, the crops are destroyed. So it's a major disaster that we're experiencing. It's even worse than the 2002 eruption.
Ambassador, how are you sort of working with Rwanda, considering you have a bit of a complicated relationship with neighbouring Rwanda, and that's where they seem to be fleeing? How are you sort of how are the two countries working together now to sort of help these, if we can call them refugees at this point?
Well, they are accommodating them. We have, as you said, historically we have a complete relationship. But as we speak, we're working very well with Rwanda. The two presidents are communicating, so they are trying to cope with it. You know, Rwanda is a very, very tiny country. So when you have thousands of refugees fleeing into to Rwanda, it's difficult to see what they can really do to accommodate them. So we are going to basically rely on the international community, UNHCR, Red Cross, organizations like this to come to our rescue.
So what is your most urgent need at the moment? I mean, we see that a lot of the evacuees, if we will call them that, have been trying to get to Rwanda. Some of them have had to turn back and come back to their previous homes or what's left of that. So what is your most urgent need at the moment to help them?
The most urgent need is the organization maybe of the refugee camps. The human factor is more important. So if we can accommodate the refugees, offer them asylum, some kind of accommodation, that will help. But we're also facing this food security issue, because it's good to receive the refugees, but they have to be fed. So, and Goma is a very fertile area. That's basically where we produce most of our food. But if the food crops are being destroyed, if animals are being burned by the lava, and even if you put people in the refugee camps, what are they going to do? They still have to eat. So, so basically, the human element is the most important factor, so that if we accommodate the refugees and so forth, but not forgetting that we need to feed them and so forth, and their crops, animals are destroyed.
And in terms of aid agencies being able to reach those in need easily, do you know what plans are being made, what arrangements have been made there?
They've been a bit slow in reacting to the crisis, but what I understand is that they are still organizing themselves. But it came out of nowhere, no warning. So people were not really prepared for that, but the aid agencies are organizing themselves, Red Cross, UNHCR, and so forth.
All right. And just, you say this came out of nowhere. So what sort of assurances are you being given? Are you watching the area of this volcanic activity now, or does it seem like it's over for now?
No, it's not over, because you can use the technology to monitor an eruption of a volcano, but it's difficult to predict. It's not like an earthquake. Because the volcano is alive. Yeah. But when it's going to erupt, you have no warning. You don't know when it's going to erupt because it's alive all along. So it's very, very difficult to predict. And now that it's happened, it's a matter of mobilizing all the assistance, all the help that required to come to the rescue of that region, which has already suffered a lot because of the armed groups, because of we're still feeling the impact of 2002 eruption. So there is an urgent need for assistance.
And let's just talk about the other threat that they might be facing at the moment, that of disease, and also in the middle of COVID-19. So how are you managing that?
They have been managed quite well, but unfortunately, one clinic has been destroyed, and I don't know how many more there's going to be or in danger of being destroyed. So far, in terms of pandemic, in terms of Ebola has been put under control. In terms of the pandemic, I think they've been doing very well, trying to cope with it. The rate of infection in that region is it's one of the lowest in the country. So our medical team has done a very good job, of course, with the assistance of the international community, like WHO and so forth. But with the clinics being destroyed, with people running away, of course, we don't know what impact of the COVID is going to be under those circumstances.
Okay. Ambassador Ben Mpoko, thanks very much for your time. We'll continue to watch the situation there after that volcanic eruption there in the DRC.